The Miracles Among Us by Dr. Marc Siegel. Dr. Marc Siegel is a practicing physician, professor of medicine, and senior medical analyst, widely known for his commentary on health and science. In The Miracles Among Us, he draws on decades of medical experience observing cases that defy conventional expectations. Published in 2025, the book blends medical insight, personal narrative, and reflections on faith, hope, and resilience. Siegel's central premise is that miraculous recoveries often arise from the convergence of multiple factors: expert medical care, timing, human perseverance, and sometimes what believers interpret as divine intervention. He frames these as soft miracles, recoveries that appear improbable but can be explained in part through medicine, human effort, and faith. Occasionally, he discusses hard miracles, which are truly inexplicable medical recoveries, though he stresses their rarity. Science and faith are not opposites. Siegel emphasizes that spirituality does not conflict with medicine. Instead, faith, prayer, and human hope can work alongside science to produce extraordinary recoveries. He stresses that science provides the tools, surgery, medication, intensive care, while faith, resilience, and determination provide the unseen support that can tip outcomes in favor of survival. Human agency and resilience. A recurring motif in the book is human perseverance. Patients, families, and medical teams frequently demonstrate courage, creativity, and determination. These qualities, Siegel argues, are essential ingredients in the miracle equation. Humility before mystery. Siegel does not claim to have all the answers. He presents uncertainty as an inherent part of medicine, suggesting that acknowledging the unknown is essential for doctors and patients alike. Healing often occurs at the intersection of chance, skill, and what some might call divine timing. Universal spirituality. While many cases draw on Christian faith, Siegel includes examples from diverse religious and cultural backgrounds, emphasizing that the experience of hope, prayer, and miraculous recovery transcends any single belief system. Representative stories. 1. The newborn who defied odds. One of the most dramatic stories involves a newborn diagnosed with a severe congenital heart defect. The child's survival was uncertain even with state-of-the-art neonatal care. Siegel recounts how the medical team worked tirelessly while the parents prayed and maintained unwavering hope. Against the statistical odds, the child survived and thrived. This story illustrates the interplay between expert intervention, parental determination, and what Siegel calls timely providence. 2. The athlete resuscitated after cardiac arrest. A young professional athlete suffers sudden cardiac arrest during training. Emergency responders arrive within minutes, but the likelihood of full recovery is low. Through swift resuscitation, advanced medical care, and seemingly miraculous timing, the athlete survives and eventually returns to full activity. Siegel highlights the convergence of skill, technology, and circumstance, noting that moments of rapid response can feel like miracles in hindsight. 3. Survival in war-torn regions. Siegel tells the story of a child in a war-torn country undergoing a risky surgical procedure. With limited resources and inadequate facilities, the surgical team relies on ingenuity and resourcefulness. The child's survival is improbable, yet the operation succeeds. Siegel uses this case to demonstrate that miracles often arise in unexpected contexts, where human courage and improvisation compensate for scarce resources. 4. Rare disease remissions. Several cases involve patients with life-threatening diseases who experience unusually rapid or complete remission. Siegel notes that while these cases are medically rare, they are not entirely inexplicable. They often involve a combination of accurate diagnosis, innovative treatment, patient determination, and fortuitous timing. These soft miracles challenge medical assumptions while reinforcing hope. 5. The role of faith in healing. In multiple stories, Siegel observes that faith and prayer can influence the recovery process. He recounts instances where patients or families credit spiritual practices with tangible improvements in health. While he does not suggest faith alone causes recovery, he emphasizes that belief, hope, and positive mental states can enhance resilience and recovery outcomes. 6. Psychological and emotional miracles. Not all stories involve physical healing. Siegel includes examples of patients achieving emotional or spiritual recovery alongside medical treatment. For example, a terminally ill patient finds reconciliation with estranged family members, leading to a profound sense of peace in their final months. These cases demonstrate that miracles can encompass psychological, emotional, and spiritual dimensions, not just physical survival. Reflections and insights. The convergence principle. Siegel repeatedly stresses that miracles, particularly soft ones, result from the convergence of multiple factors: medical expertise, patient resilience, timely intervention, and sometimes spiritual or communal support. When all these align, outcomes can exceed statistical expectations. By sharing these stories, Siegel demonstrates the therapeutic power of narrative. Patients, families, and medical practitioners can derive hope, comfort, and inspiration from witnessing or learning about miraculous recoveries. The book emphasizes that medicine is not always predictable. Siegel challenges readers to accept uncertainty, cultivate hope, and respect the mysterious dimensions of recovery that defy easy explanation. Balancing skepticism and openness. Siegel encourages a balanced perspective. While extraordinary recoveries may seem miraculous, careful observation and scientific reasoning remain crucial. He asks readers to remain open-minded without abandoning rationality, framing miracles as extraordinary yet sometimes medically plausible phenomena. Conclusion. The Miracles Among Us offers a compelling exploration of the intersection between medicine, faith, and human resilience. Dr. Marc Siegel presents a nuanced view. Miracles are not always instantaneous, inexplicable events, but can emerge from a convergence of skill, determination, timing, and hope. Through dramatic recoveries, near-death survivals, and emotional transformations, the book celebrates human perseverance while inviting reflection on the mysteries of life and healing. Siegel's work encourages doctors, patients, and believers alike to embrace humility, maintain hope, and recognize the sometimes unpredictable interplay of science, human effort, and spiritual presence. Whether readers are seeking inspiration, insight into medical anomalies, or a broader understanding of healing, The Miracles Among Us offers a thoughtful, moving, and provocative perspective on what it means to witness and experience the extraordinary in everyday medicine.